as a result of air pollution caused by climate change processes. I just try to put this this schema for you to visualize what I'm trying to illustrate. We all live in the environment, and even as doctors, we cannot run away from this impact. We do face it. I recall when I went to Djibouti during the peak of the COVID-19 vaccination outbreak, we could not hold vaccination campaigns because the ambient temperature in Djibouti at that day was like 42 degrees centigrade. Even the vaccine carriers could not be put outside. We had to put vaccine carriers in an air-conditioned vehicle, and then we introduced the antigen into the arms of recipients through the window of the air-conditioned car. So as a medical doctor, if you do not take this into consideration in your programming, how efficient would you be? Or you would rather take those vaccines and put them out, and by virtue of the temperature, they'll be denatured, and you just introduce non-viable antigen into the arms of individuals. And shortly after that, they get the disease because they're not protected. They come to your hospital, there's a lot of complication, even you are at risk. So these are things that you must factor. These are knowledges that are essential to building your health career. We have a very complex interaction with the environment, and that complex interaction sometimes will lead to e-health. And that complex interaction is further impacted by climate change, sometimes which we do not have control over, but we can create adaptive scenarios to be able to withstand the impact of climate change. Now, to bring out the magnitude of this problem in numbers, it is good to note that environmental risk factors alone is aggravated by climate change, is causing increased burden of diseases across the world, with our continent at greatest risk, primarily because apart from weak health policies, which we've been suffering from, we are suffering from high level of poverty, which diminishes the capacity of most of our population to be able to afford and pay for quality health services. Also because we have systems that are less adaptive to this environmental health impact, as well as less resilient to climate change impacts. It's good to know that it is a fact that 23% of all global deaths are linked to the environment. So what it does mean is that if we remove the environmental factors of disease causation, we will reduce the global mortality of about the global mortality currently by 23%. So that means we'll be reducing about 12.6 million deaths globally. If you're a doctor and you contribute to this, even if it is just 2% of this, I think you should be fulfilled. Okay? And how much life can we save in the clinics as compared to how much life can we save in the community? These are continuous debates that you must continue to have in your mind as you progress through this discipline. Now, in terms of some breakdown, it's good to note that by regional distribution, Africa experiences 2.2% of these 12.6 million deaths. Okay, and that's significant. That's really significant. And then they've looked at the 10 top most causes of deaths from the environment. Whereas in most developed countries, where you see 3.8 million contributions, and please bear in mind the populations of these regions that we're looking at as against the population of Africa. So when you do something like, if you disaggregate these deaths by proportional allocation based on population, you'll find out that the death burden in Africa is significantly higher compared to most other regions. Now, we looked at how these causal effects are distributed by the conditions that cause them. And we find out that although most of them are caused by non-communicable diseases, as we see from 1 to 5, the 2.2 million deaths that are accounted for in Africa are primarily driven by infectious diseases, ranging from diarrhea diseases, which we've continued to battle, especially in the Eastern African region. We are currently about 50% of our 14 member states are experiencing protracted cholera outbreaks with significant deaths that is greater than case fatality ratio of 1.0, significantly greater than that. So you see, in our continent, we are not even battling so much with the challenges of non-communicable disease as it is in most other climes that have better economy. We're still struggling with the minimal, the basal, things like diarrhea diseases, things like malaria that has been long eradicated in many climes, things like intentional injuries, neonatal conditions with high mortality and maternal mortality rates, high infant and maternal mortality rates, and then, of course, respiratory diseases. So, colleagues, this is why I think that it is important that you guys are discussing this thematic area of climate change nexus with health. I don't think this is a concept of providing knowledge. I don't think this is a concept about overflogging or hyping climate change. No, it is a reality that is living with us. And unless we discuss it at forums like this, we might not appreciate the burden and the need to be intentional about advocating for a change in this regard. Now, in our continent, we have seen tropical cyclones cause not just infrastructural damage, but significant damage to health systems with increased mortalities and morbidities across most of the impacted member states. But zoning it down to Kenya, you guys will remember of the recent El Nino flash floods that happened just last year. And I was at the Regional Climate Outlook Forum that happened in January, where projections were made for the March, April, and May season. And we still see this variation. Whereas in so many places we're having floods that are aggravating diarrhea disease outbreak, in some other places we're having drought that is impacting and causing malnutrition, food insufficiency, and also diarrhea diseases, because now people have to depend on several unsafe sources of water for survival. But beyond all of these factors are contributing to continent-wide disease outbreaks. This is why, for you, I think we should look at climate change into perspective purely from the health mindset. And I want us to be very open-minded about this discussion because I will appreciate an interaction. So for me specifically, I see that most times when people talk about climate change, the focus is usually around the causal perspective. You know, in health, the first question we want to find out, what is the cause of this problem? What is the causative organism? So that will inform how we treat. So we also use that mindset to relate with climate change. But for me, I'd rather we relate to it from both a causal perspective and from a response perspective. Causal because climate change is directly and indirectly driving the occurrences of any public health emergencies, including disease outbreaks. Response in the sense that climate change is undermining and limiting the implementation of several disease control intervention programs. And I'm going to give you examples. Now, let's first look at the causal perspective. And here we're looking at climate change as an influencer in the occurrence and distribution of pathogens, which often exacerbate disease occurrence and increase and increased hospital visitations, with, of course, a great deal of burden to the health service provider. In the SADC region, the SADC is actually Southern Africa Development Commission area, we've seen significant cyclones impacting large populations, causing displacement, and with displacement comes its health implications. Sorry, can I confirm that I'm being heard?
Yes, we can hear you.
Okay, so maybe, okay, I'll try and speed it up a bit, and for want of time, I was getting a call from your general secretary, so I wanted to know why. Okay, so let me speed up a bit. You have concerns about time, isn't it?
Yes.
Okay, so let me speed it up a bit. So generally, I was just talking about the floods in the Southern African region, and then we're seeing, of course, also a great deal of that in Kenya. We've seen drought in the Horn of Africa, but suffice to note that the impact of climate change on human health has varied implications, and some of these are highlighted. I'll try and share this slide, but also to note that climate change direct causes direct impact could be seen in the effect of vector-borne diseases, waterborne diseases, airborne diseases, and foodborne diseases, and sometimes direct climate change contact, like, of course, increasing zoonotic diseases, where you see a lot of animals leave the wild because of the varying climate change situation, to go into human abodes to be able to look for nutrition. And in that process, they introduce zoonotic diseases into the setting. There are also diseases we've classified as climate sensitive diseases. And you can see how this is distributed. Many of us can relate very well with malaria, yellow fever, dengue fever, and then cholera as waterborne disease, water and foodborne diseases. So we've also seen some respiratory diseases. Sorry, this was supposed to be respiratory diseases or air quality borne diseases. And we've also seen this in several places. But suffice to say that it is important we discuss climate change at this point, because as it is currently, of the over 2,000 public health events with significant morbidity and mortality implications in Africa in the last 2 decades, 56% were related to climate change. And it is projected that there's going to be every year an additional 250,000 deaths from 2030 upward if nothing is done about climate change. Also highlighting this, you can see climate change impact on human system. If you look at the impact on health and well-being in Africa, whether you're looking at infectious disease, or you're looking at heat, nutrition, and others, or you're looking at displacement, climate change is playing a significant role, and this is driving public health situations in Africa. Beyond what we just saw, it is also good to know, because again, as health practitioners, we usually also evaluate the impact of a determinant economically. And that's where we look at quality adjusted life years, we look at DALYs, we look at the quality of life and all of that. And you see that it's been recorded here that direct damage caused to health is estimated at over 2.4 billion by 2030 as a result of climate change impact. And this is very, very important for us to note. Now, what is the pathway? How does climate change cause disease? Basically, there are 2 critical climate change factors that drive disease causation. This is temperature and precipitation. Precipitation is actually rainfall, which actually leads to all of what we see. So you're looking at heat, extreme cold, flood, fatalities associated with flood, injuries. These are direct causes, like I have said. Then there are secondary effects, which is now seen in the second, like air pollution as a result of haze, as a result of trapping of dust particles in the atmosphere due to high precipitation, water vapors, and all of that. Then, of course, there is also the tertiary effect, which is manifested in long-term famine, resulting in malnutrition, and also sometimes also chronic diseases. Now, in all of this, we see an exacerbation of waterborne diseases, foodborne diseases, and vector-borne disease. Now, as health workers, we should also be concerned about the proportional disaggregation by gender in the impact of climate change. And it's good to note that in our region, women and children are most impacted. And this is because of the gender-specific role of women, especially in the African setting. And so whether you're looking at disease vectors, women, children are significantly impacted, supply of clean water, increased pollution, decreased food security, and extreme weather events. We've seen a lot of impact of heat stress on fetal deaths, with many publications on that. And for us as medical students, we are categorized as youth. And it's good to note that this also impacts us directly or indirectly. Now, some of the impacts for us as youth include the negative impacts associated with adolescent well-being, like biological, emotional, and social development. The climatic factors can actually undermine all of this and adding additional stress to adolescence, which can also in itself transmute into other things. It affects our physical well-being through increased risk of injury, lung disease, infectious disease, and poor nutrition. But again, it disrupts connectedness. We've seen families displaced during flood, and the family is completely disoriented. And of course, if you're a medical student and you hear that your family, there's a flood in your county, in your community, and then your family is completely wiped out, it will take you a while, of course, to adjust mentally. There are a lot of mental health related issues that we've seen with respect to climate change, with many of the youths at the epicenter of that impact. I've talked about the response perspective, where you see you can do a health programming today to conduct immunization campaign in say Nakuru, and then there is a flooding just the night before your campaign. You see populations displaced, and those populations will become missed during those campaigns, only for you to have a resurgence of infection just immediately after campaigns, which is not which shouldn't be the best. So I work with Africa CDC, and I lead the climate change and health portfolio. And in Africa CDC, our vision is to pursue a safer, healthier, and prosperous Africa in which member states are prepared to timely prevent, detect, and respond effectively to public health threats and outbreaks. And what we are saying in Africa CDC is that as medics, we cannot do that effectively without integration of climate change in thought and programming in our approaches. You agree with me that also, even for early warning, alert, and response system for surveillance of infectious diseases, if you do not integrate meteorological information, which is climate change information and data, on those epidemiological parameters that we often define, and you work in silo, you might be running in a cycle, because you might do all that you can do as a professional medically, but unless we think that have that holistic overview, it might be difficult to contain the outbreak we're battling with. Now, what are some of the things we've done to address climate-sensitive diseases in Africa? One of the first things is regional prioritization and disease mapping. We've tried to see these climate-sensitive diseases, which are enumerated earlier on, categorized into different pathways, transmission pathways. How do we know what to focus on in which geographic climate? So we need to prioritize and we need to map. Now, how do we strengthen epidemic and pandemic preparedness activities? One of the ways is discussing this at MSAKE. And as we're discussing it, we're beginning, I'm hoping that I'm stimulating the hunger to want to see what are the implications of climate change in causing diseases, even at clinical level. Because if you treat somebody sometimes without understanding the environment in which they thrive, you might finish the treatment and have them come back to hospital a few weeks later, just because the root cause of what you were treating have not been addressed. So it is something to think about. We cannot think epidemic.
Sorry, Dr. Charles, I think you're muted.
Okay, can you hear me?
Yes.
Okay, yeah. So what I was trying to say is that these are some of the activities that we're doing, and I think as health practitioners to be, we should be able to appraise ourselves with some of these processes, because sometimes you never will know what area you might want to focus. And even as medical students, who told you can't contribute? Who told you cannot contribute in your different associations to do advocacies and look for organizations that support these processes? But you can only contribute if you know what to do. You can only contribute if you know this is a problem and how you can use your expertise to enhance even community resilience. There are community practices that sometimes drive vulnerability to climate change, and as health practitioners, we can actually rise up against those practices collectively or in groups of associations and try to provide some interventions, trying to leverage other partner support. So this schema actually shows you disease distribution by mapping. We talked about mapping. This is from our epidemic intelligence unit. This is over time, some of the diseases, and we try to prioritize them to see which one has the greatest impact and what is the geographical spread, so that when we're doing interventions, they are targeted and they are focused in the areas of greatest vulnerability. And to do this also, you need to also understand that as health workers, the time is far gone when we want to work as professionals in a silo approach. We do know now that there are a lot of other determinants of health which is not within the jurisdiction of our discipline. And the only way to ensure a holistic approach to health and the well-being of the population we serve is to be able to address health interventions broadly from a One Health approach. And One Health is a collaborative, multisectorial, and transdisciplinary approach which is used to attain optimal health outcomes for people, animals, plants, and their shared environment. And because you might be focusing on people alone, but if what is causing the disease is in animals, by the time the people get treated in the hospital and they go back, the animals in their home will reinfect them. And then the cycle continues and you keep losing lives that could have been saved. So it is better we begin to look at health from this greatest perspective. So I'm not going to go through most of the other slides for want of time, but suffice to say that overall, we see that if we do not intervene around climate change, you have an additional, you see, antimicrobial resistance is just about 1.27 million contribution to death. But you can see climate change, 14.5 million contributions. So if we do not intervene, and if we do not intervene on this, you can imagine the cascade of reactions that will happen. Now, we're saying that there are approximately 282 million people who experience high levels of acute food insecurity in 2023. Do you know that climate change can contribute to that? Do you know that climate change contributes to antimicrobial resistance? Sometimes there's flooding and there's wash-off of hospital waste and due to improper disposal. And those wastes sometimes might contain organisms that have developed resistance to certain antibiotics. Nosocomial infections and how difficult they can be to treat because they are in the hospital environment and they've often been exposed to multiple antibiotics. Now we're talking about 75% of emerging and re-emerging diseases of humans being of zoonotic origin. Like I did show you in the epidemic triangle, climate change is contributing to all of these other ones. Yeah. So I'm not going to bore you with with our specific activities on climate change, but I think I want to end with these areas, because you need to ask yourself as a medical student, what is my role and what do I need to do? Now, the first thing that we're doing through this presentation is to create the right awareness and also to provide some form of capacity for you to understand and know that you can begin to think of climate change. It's not just the 1 degree rise in temperature, like some of you might have previously thought. And this cannot be overhyped. If you, no matter how much you talk about a determinant that is costing 56% or contributing to 56% of your public health events in 2 decades, you will know that it's not overhyped, because the earlier we begin to do something about it, the better it will be for both you as a service provider and the population yourself, because we are all at risk. Okay? So I'm hoping that this will stimulate you to start thinking of what you can do around creating awareness at different levels where you find yourself. Talk about climate change. And I promise you, you will never overhype it, because it's the issue of the moment. And it will be the issue for a very long time to come. Then evidence generation. People are beginning, I've seen health practitioners doing a lot of researches around climate change. You can want to do that. You can actually try to do a post-flood evaluation assessment in a community to see what are the most hazardous practices that the community has adopted. What are the adaptive mechanisms that they can adopt to be able to withstand similar occurrences? And what was the public health implication of those flood disasters? Those are simple, easy to do research that as medical students, you can even do for your end of year thesis. And then you can actually create some linkages. And that will be very interesting, sometimes for some partners to interact with. Then multi-sectorial collaboration. I needed to give us that expertise. Despite finishing my first degree, I did a master's in feed epidemiology, where we had a One Health program. And you'll be shocked at the wealth of experience and knowledge that is within the animal health sector, within the environmental health sector. And when 3 of us sit in the same forum and learn together, we were able to have a more holistic picture of health and then human well-being, as compared to some of us who might want to just remain tailored to what we're learning with the human system. But you do know that unless the environment and the animal populations have some level of safety, the human beings won't also be safe. The next one is, of course, for us, you can volunteer. I started my work as a volunteer when I did my National Youth Service post-graduation. And I can tell you it was a very great experience. Who told you that as a medical student, you cannot go to an NGO that does things like this and say, okay, I want to volunteer. I want to be able to support the climate action around health. I want to be able to champion that. And you grow in that perspective. So there are a lot of organizations that you can actually volunteer. And many times you find out that you're already leaving school, you've ingrained yourself in some of these frameworks. Then, of course, financial and technical support. You can also base premise on your understanding. Begin to write and look out for grants that you can either write and implement as a youth wing, supporting the resilience and adaptation building on climate change and health in the different communities. And you can look at those grants. You can also solicit for grants. You can write to a funding partner and say that recently there was the impact of flood, and then a lot of people were displaced. In those displaced camps, there has been an outbreak of diarrhea diseases, and we were going to do XYZ as a student body. And you can really try to. There's no harm. They say no pain, no gain, and you lose 100% of a shot you never take. So sometimes, unless you do this, you might not even know what you're capable of doing. Then the last one is implementation of early warning and alert response system, which is you need a very sensitive surveillance system to promptly detect disease so that we can prevent epidemics and pandemics. And one thing that we're trying to do is to see how we can incorporate climate change data, including engaging communities and beneficiaries on early warning system and community-based surveillance with the incorporation of climate change so that we can reduce and address vulnerability among at-risk communities. So thank you very much. These are just, I highlighted some other sites that we can actually avail ourselves with a lot of information on this issue. Thank you for your attention. I'm open to discussion, questions, and interaction. Back to you, Masaki, Secretariat.
Okay, thank you for your very elaborate presentation. And even at this point, I think why even we invited the Africa CDC to speak on it is because before you even came, we had the Global Climate and Health Alliance. So showing how it's a global concern. And now we have the Africa CDC showing that this is a regional concern and it's closer to home. And so thank you for giving us those points and even data specific to our region that we can think about. I mean, I think I had mentioned earlier that there was another student who did research on how the knowledge and attitudes and practices around health workers and seeing how malaria is increasing in places where it wasn't in Kenya. So even so, there are even other ideas for research ideas for those who love research, and a lot of the gaps that we can fill in. So I think at this point, what I'll do is also just maybe invite one or two questions from the audience. Would anyone like to have and then to make a question to Dr. Charles, or even okay, thank you. So we have Pwani University Medical Student Association President Victor, Dr. Victor.
Okay, thank you, Dr. Charles. Maybe for lack of better words, I would say you have actually demolished the topic. My main question is, currently, is there any medical research or maybe recent studies that are trying to mitigate maybe climate related health risks that medical students should be aware about or maybe advocate for?
Sorry, you're
Did you hear
breaking
that?
off. I can't hear anything from here.
Okay, I think he'll repeat the question.
Okay, thank you. My question is, are there any recent studies or innovations in mitigating climate change related health risks that medical students should be aware about or maybe advocate for?
So maybe the most recent one I can take you to is a recent publication on the Lancet around climate change and neglected tropical diseases. But beyond that, actually, on the internet, there are a lot of researches and published evidence around climate change and malaria, climate change and diarrhea diseases. Currently, there's a grant notification that we're trying to work on from the European Union Commission on diarrhea diseases and climate change. Although they are looking for, they want something on late stage clinical trial around innovative treatments for diarrhea diseases, and then also looking at geographical disparity in terms of vulnerability to diarrhea diseases and how that geographical distribution is informed by climate change. So there is a lot, and in short, an avalanche of work on that. If you go on Google alone and type published, you can just say published articles on climate change and health. I'm sure you will see quite a lot. And if you do a scoping review, you can actually see a lot of publications that speak to your area of interest. I don't know if that answers your question, but thank you.
Thank you.
Okay. So are there any other questions maybe? Because I think you already answered the question of what students can do or youth can do to get involved, as that was really mainly the question. Because even other than the Africa CDC, this is a topic which is also a tabled event for the Africa region WHO and in other African bodies. So yeah, is there any other question? And I think without further ado, we can close this session as we also have some breakouts. So thank you so much, Dr. Charles. We're really humbled that um, an organization as large and as influential in our region as Africa CDC has made this time to also speak to us as the medical students of Kenya. And yeah, Dr. Akataobi is based close to Kenyatta. So very welcoming if you'd like to delve into these topics and the other areas that he is influential in. So we wish you a good day and thank you.
Okay, thank you very much, Mafoka and colleagues. I think I can see the picture. I can see the hall now. I wish you guys a very fruitful discussion and outcome of your meeting. Thank you very much.
Okay, so we're going to do breakout sessions, which will be now your chance to interact with each other. They'll be coordinated. We'll divide people according to standing committees, and in pairs. So we're going to have uh, people who for standing committee of rights and peace and standing committee of medical education, facilitated by Ted and Thaddeus and Eric. So you're going to stay in this room. Then we're going to have the sessions which will be coordinated by a standing committee of mental health, standing committee of professional exchange, and standing committee of research exchange. So those will be done by Kirwa and Eliab. And then we're going to have that's in the other room we were in yesterday. Then we'll have the sessions for standing committee of SCORA and the standing committee of public health by Stacy and Karen, and they'll also be in the other room. The other room has been split into half, so we can meet in those rooms. They can take 5 minutes to go into those different rooms. So I really urge you to get there quickly so that you can be able to do the sessions and be able to go to lunch. And then from there, we'll meet at the field for our team building, and even after lunch or during lunch. I really hope people came with their costumes, but if you haven't, we'll just see what to do about that. I can see people nodding very aggressively. So, yes, please let's make haste to just go to the sessions which have been prepared. If there's any questions, is there any question on the rest of the flow of the day? Okay, so yeah, just make sure you interact. Please don't stay with people from your school. Hang out with other people. Get to know people. Your net worth is your network is your net worth. Yeah. So please correct. If you don't come out with more than 5 numbers, I don't know. Sijui sasa. So, anyways, as I said, so the people for Scora, you can start discuss. Oh, hi Karen. Yeah. So the people for Scora, Stacy and Karen, so we can just go, and then the people for SCOM H, Scopy, and Scory. So the people actually staying in this room will be the scorer and scope, right? So they'll stay in this room, but so you'll exchange now with Scomi and Scorp. Exactly. So Ted and Eric, you can go.